Welcome to the body imaging cases. A 50-year-old man with bilateral undescended testicles, which were identified intra-abdominally on this ultrasonography. We see here a photograph of the patient's abdomen, and the position of the transducer is marked in red for each of the two images. This could be just a case of bilateral undescended testis without an underlying disease. But a certain observation here will tell us that we are dealing with an underlying syndrome. This is in a normal patient, the normal appearance we expect to see on ultrasonography of the abdominal muscles, the external oblique, the internal oblique, and the transversus abdominis. Now let us look at our images. On the left side, the abdominal wall muscles are entirely absent, and on the right, they are extremely deficient. And this, in fact, shows itself on the clinically on the skin of the patient, which is corrugated and wrinkled, looking exactly like the dried prunes. And that's where the name of this syndrome comes from, the prune-belly syndrome. This is a coronal MRI of the same patient showing the undescended testis bilaterally. And these are better appreciated on the fat-saturated T2 weighted images. And on these transverse T2 weighted images, we see the extremely deficient anterior abdominal wall muscles. We appreciate the agenesis of the right seminal vesicle. The prostate is entirely absent, and it is replaced by thickened bladder wall muscle. And the shape of the urinary bladder itself is rather tubular. This is the appearance of the absent prostate on the sagittal image, the tubular appearance of the urinary bladder, and the absent anterior abdominal wall muscles. On this dynamic gadolinium-enhanced MR angiography, the right kidney is supplied by two renal arteries from the aorta. This is just an incidental anomaly. But the characteristic feature of the prune-belly syndrome here is the appearance of the ureters on the most delayed images of the gadolinium-enhanced study, the MR urography. The ureters are dilated, elongated, and their middle thirds are displaced laterally. This is the three-dimensional image of the delayed phase of the gadolinium-enhanced MR urography. And here we are fusing together the gadolinium-enhanced MR urography image and the T2 weighted images, which showed us the bilateral undescended testes. We noticed that the undescended testes are located at the same level at which the ureters are displaced laterally. So the diagnosis here is prune-belly syndrome. And we have learned to look at the anterior abdominal wall on performing abdominal ultrasonography, not just the internal organs. We have learned some of the imaging features of prune-belly syndrome as enumerated here. And this will be our next case. A female, 38 years old, with recurrent acute right iliac fossa pain.